Chairman DiGirolamo.
Thank you, Mr. Chairman. Secretary, welcome.
Good afternoon, sir.
Good afternoon. And first, I want to thank you for your willingness over the last 2 years to work with me and the members of my committee.
Been my pleasure, sir.
And especially I want to thank you and Deputy Secretary Nancy Thaler for your willingness to listen on this issue of the covered workshops. And we're going to have a hearing on Monday, but I really, really appreciate both of you going around the state listening to the people involved in this. And I don't want to say we got an agreement, but I think you're very, very close.
Thank you for your advocacy as well, sir.
Compromise and agreement. We're going to part ways a little bit here. I'm going to talk about the consolidation. This is your proposed booklet, I guess, on the proposed new Department of Health and Human Services. Your streamlined department, 761 pages. On page 1, you've got a program statement with, I think, 9 or 10 offices, 1, 2, 3, 4, 5, 9 different deputy secretaries. And as I said last week, and I'm just going to concentrate on DDAP, drug and alcohol.
Sure.
Why in the middle of what we're experiencing with this heroin, especially in the opiates, why would we do away with the lead agency in charge of this disease and bury it in this bureaucracy? It just doesn't make any sense to me. And my question to you, and Representative Briggs already asked it, I mean, why do you think this is a good idea? And if I heard you, you said share information, least amount of bureaucracy, reimagine state government again, save money, less complicated, reduce regulatory burdens. So I'm going to ask you a different question. Shouldn't we be doing that already?
Well, okay, so which question do you want me to answer first?
Well, I mean, all the things that you said are the reasons that we're doing this. I mean, in my mind, shouldn't we be doing these things already? Shouldn't the different departments and agencies be talking to one another and trying to streamline things?
So I think the answer I would give you is, first, I think we are doing those things. I think the consolidation provides an opportunity to do more of it and to do it better than we're doing now. Certainly work together on a lot of issues. I know there might not be a meeting of the minds on this particular aspect, but you had asked, why in the midst of an opioid crisis are we talking about consolidating agencies? And to me, I think it's precisely because of things like the opioid crisis that we're talking about consolidating agencies. When you think about the splitting those services between between DDAP, health, and DHS, and then looking at the results we get, right? If you think about just two numbers, just think about two numbers for a second. You asked me a question, I'm doing my best to answer it. I know we're under time constraints, but if you think about it, I'll think two numbers for you: 52 and 68. 52 is the percentage of people who we know have a behavioral health issue, who also have a substance use disorder. Those are folks who get services largely from the Department of Human Services. They get some services from health. They get some services from DDAP as well. Now, if you think about those folks, it's numbers higher than that. Creating artificial barriers for those folks when we have an opioid crisis and when folks are dying and that number is going up, that to me is the thing that we need to address. So just to finish my point, though, if you think about right now where we are, folks who get detox, 68% of the folks who get detox, right, they get no other services. They don't get those behavioral health services they need. They don't get the physical health services they need. And to me, that's the thing that means we have to do consolidation, and we have to do it right now. Because at the end of the day, not providing services to those folks at a time when there's a crisis and there are folks dying because we're focusing on whether we have this service in that box or this service in that box, that's the thing that I think we need to address.
I would disagree with that, because when people get into treatment for drug and alcohol, those treatment facilities also provide mental health services also. And if they can't provide those services, they find a facility where those services are able to get. If you read Act 50, Ted, I don't know if you ever read Act 50. If you read Act 50, which is the bill that created the Department of Drug and Alcohol programs, it outlays all the stuff that you're talking about. Interaction between agencies, between DTAP and the other agencies, and between departments, it's all in there in Act 50. So
I can tell you what the results are now, and the results are folks aren't getting those services, and the number of people who families that are being rifted apart, the number of people who are dying is growing. The system we have right now is not meeting their needs.
If we
I'm
didn't
saying
have,
at the end of the day that we can do better than that.
Our time is up, but if we didn't have the Department of Drug and Alcohol I guarantee you things would be 2 or 3 times worse than they are right now.
So
thank you, Mr. Chairman.
I think we'll respectfully disagree with that, sir.